Okay. Hello, everyone. This is me again, Razan Hamid, and I have with me today a very dear friend and an esteemed colleague in the OT field, Rawan AlHeresh, or Dr. Rawan AlHeresh, I should say. I'm really excited to talk to you, Rawan, today because I know you have great experiences and reflections about the intersectionality of Arab identity and an OT. So I can't tell you how excited I am to have you on this recording today. Welcome.
Yeah, thank you very much for thinking of me, and I'm excited to be here and share my experiences. Yeah.
That's great. Okay, so let me introduce you to Rawan. She is a woman of so many talents, but we want to highlight today a few of them. Rawan, Dr. Hirsch, she's an occupational scientist. I love that, with expertise in cross-cultural adaptation and access to rehabilitation measures and interventions to underserved communities like refugees, asylum seekers, and non-English speakers. Dr. AlHeresh is the founder and director of the Toward All-Inclusive Jordan, which is an academic community partnership program serving as a platform for education, clinical training, and advocacy for the rights of people with disabilities using community-based rehabilitation in the Middle East. I know you've always been passionate about this.
Yes.
Ever since I met you way back in 2008. Dr. Hesh, she is a very strong candidate for advocate. Okay.
Candidate. No, I'm not. I'm done with school. Yeah.
Strong advocate for refugees and asylum seekers in the US and globally, especially those with disabilities and non-English speakers. Again, I'm thrilled to have you. Welcome on to this.
Thank you.
Okay, so with that, I would love to ask you a few questions about your education, your professional roles, and your Arab identity, and how all that mix play out in your life right now. So my first question to you is, if you're willing, can you please describe your Arab identity in terms of origin, your culture, the language you speak, and any traditions you'd like to highlight as an Arab OT?
Sure. So I am an Arab-American, and I am originally from Palestine. I was born in Jordan. So I identify as Jordanian / Palestinian / American. And I speak, my mother tongue is Arabic, but I was introduced to English in my elementary school, as I did live parts of my childhood in the UK. So I learned Arabic before I learned English, but I do consider myself as a bilingual. So I speak both. I think I speak English better than Arabic now, but just as but my first language was Arabic, and it still is, of course. I identify as Middle Eastern practicing Muslim as well, and I think my Arab identity and my culture influenced my practice of rehabilitation and occupational therapy, specifically very early on. In my in my career as an OT. I think I'm also a mother of 3 kids, and I am a first generation immigrant in the US, so I understand firsthand the difficulties of being like an immigrant. And how access could be problematic for people because, they don't identify as the majority group. So as you mentioned in the very kind introduction, I'm always, advocating for access for those who have difficulties just because, I experienced them firsthand as a person, as a mom. I have, some of my, 2 of my kids, they do get like special supports, including OT in schools. So I know if I wasn't informed about this, I wouldn't have, been able to request them. And I know that many moms and many parents and many caregivers, like in the US, wouldn't have a chance, because of the difficulties related to differences in culture and in language. So access for me is something I'm extremely passionate about, and I'm always, bringing this up and center, let's say. So I think my identity as an Arab has always been, what has pushed me towards my research, my practice, and my teaching as a whole, as a scientist and as an educator.
Yeah. And I admire your work so much personally, and you know that. because it's such a hard work, because it's the road less traveled by OTs, and the problem of this, like we just posted on the group about the what's happening in Sudan now, and this is not new for waves of refugees and immigrants to come to the US or other countries for that matter. So it is hard work. It's extremely relevant to OTs, but yet we don't see a lot of OTs doing this. So I thank you as a professional that you are taking that road. My second question to you is, can you describe your current professional OT life in terms of, your clinical experience or academic role, professional activities, any leadership? I mean, you touched on that with this program, but, do you want to tell us a little bit about how OT life look like now for you?
Yeah, sure. So I have been in occupational therapy for, should I say years? It's going to give away how old I am, but it's been, I think, between 15 and 20 years. And Razan, you've been with me all through that road, so you're just as old as I am.
Yeah, don't say more.
Yeah. So I think my professional identity as an occupational therapist has gone through like different, waves and through different, turns. And it's not uncommon for OTs. Like you don't just graduate from school thinking that, oh, I'm going to be like a mental health OT. I'm going to be like an OT for SNF, or like I'm going to be an OT who works in like refugee camps and just stick to it. It doesn't work like this. I have never met an OT who stayed in their same, niche all their lives and all their professional lives, because we all, go through, waves of, figuring our professional identities, and also, just being true with the changes of our, like personal life and things like that. Things, take turns. At this time, I am an associate professor of occupational therapy at the MGH Institute of Health Professions in Boston. And as part of my role, it means that I have to do three main things. I teach, I do research, and I do work in service. So these are the three main roles that usually professors have to do. And with my role, I teach two main cores. The first one is related to community and culture in occupational therapy. And I teach in an entry-level occupational therapy doctorate program in Boston. And I also teach a course called community-based rehabilitation, where I travel with students to different refugee camps in Jordan, and we work firsthand on on things. Maybe I don't know if we'll have time, but I can get into details about that later. But that includes like a traveling component and experiential learning in real life examples. And my second role is as a scientist or a researcher. Right now, I'm working on I was just awarded a grant from the Bank of America Foundation, and that was just funded 2 weeks ago, and we're going to start working on the first mental health intervention delivered in the Arabic language for residents of Arabic speakers in Massachusetts. And it's going to be using a cognitive behavioral, intervention to be delivered by community health workers. So we care so much about the adherence, and this is one of the problems that we face as Arab, or any type of like cultural, group that is not within the norm that you see in OT, which is like the traditional middle-aged, like white person, like, this is what OT is all about and has been, taught to us. And I'm sure like Dr. Hamid and everyone in this group, they can see that the application doesn't necessarily work for different groups. So that's why we figured that I need to test, like if we're talking about depression, we're talking about stress, and we're talking about like, trauma, we need to introduce, interventions that are relevant and that are culturally meaningful to the populations that we work with. And I found that refugees who speak the Arabic language and Arabs in general in the US, they have very different, cultural norms. So for example, like a woman wouldn't feel comfortable, sitting with like a man, for example, and sharing like intimate details about some of the mental health problems that she faced. So one of the things that we're testing is the same, gender like groups and, things like this that haven't been tested before in the US. So this is one of the research projects that I'm currently engaged in, and we're going to start, recruiting people within the next few weeks for that. And then there comes the third circle, which is the service. I'm involved, heavily in a lot of the advocacy work for people who are displaced, don't speak English, and refugees worldwide. This includes the US, different groups like in Europe and in the Middle East on a global level. And I'm also engaged with a lot of occupational therapy groups, such as the Arab Regional Group for Occupational Therapy, the Jordanian Society of Occupational Therapy, and things like that. So these are part, and I also work as like a grant reviewer and reviewer for like different OT journals and stuff, and I'm always like trying to push the envelope for expanding the norm. So so that's in a nutshell. I spoke too much, so I'm just
in a nutshell. No, I know you wear so
yeah,
many hats. I didn't know
yeah,
you wore all the hats. I mean,
yeah,
this is amazing and
yeah,
impressive for one. And
yeah,
I love that you highlighted how, clients from Arab culture may, or with Arab identity may, show their culture differently. And I love the example that you gave, which is a woman may not feel comfortable sharing a lot of the intimate details about her mental health and well-being with a man. And this has nothing to do with the religion per se, which is
no,
a common misconception that Arab and religion is interchangeable identities. So I love that example. Um, this is fantastic. So next, can you tell us then about where it all started, your OT background? How did you start with this path? Because obviously it didn't happen overnight. This has been
yeah,
a long or lifetime passion
yeah.
calling for you. So how did that start?
Oh, it started a long time ago. So when I was in seventh grade, my father was doing his fellowship in rheumatology in the UK. And as part of my school, we had to take your daughters to work day. And he took me with him to his hospital. He was a rheumatologist in training. So the majority of the people that he worked with were older ladies with like white, fluffy hair in the ward. And they were all, sitting in the ward at that time. And I remember when I walked in with him, all the ladies, they just like, were grumpy. And I was like, oh, he's the physician. He's coming in, And then he asked me to just stick around because he had to do some lab work. So he went. And then when I was, staying with one of the nurses, this lady comes in and she seemed like, a very outgoing, fun person. And then when I looked at the patients, these old ladies, faces, they all like lit up and they were like, oh, it's OT time. We're going to do like this group session now. And I was like, wow, my dad, who's like the physician, he gave them the biggest grump. And then this lady comes in and everyone now is like so excited. And that's when I was first introduced to occupational therapy. So I think at that time, there was like a seed that was like planted about this, that there's something about function and doing what matters that sparks people's happiness and fulfillment that was sparked in me. And then the days passed and I didn't know like I knew about that profession and it stayed like in the back of my mind. And then I did high school, interested in continuing with a medical career, so I tried to get into medicine but then my things didn't work out. And then it was at that time that occupational therapy was recently being introduced in Jordan. And I was amongst, I think, the fourth or the fifth cohort of students in the country. And then I was like, you know what, maybe I can try. I remember, that from that experience, and I applied to OT school and I did get in. So that was when I was, first introduced to occupational therapy. But then it was very clear to me when we started, learning about all the concepts, the frameworks, and all the approaches to occupational therapy, that this is great, but it doesn't work for us. Okay, it was very, very clear. We were learning like from Portney and Watkins, not Willard and Spackman and the Pedretti, like pediatrics book and all that. And I was like, yeah, this is great, but it's just like, it just does not make sense. Like, especially at that time, I think my grandma, she had a stroke, and we learned, I remember, about the unilateral like way of dressing. I was like, oh, I'm going to go home and I'm going to try it with my grandma. Everyone's going to be so proud of me because I'm going to help her, become independent. So I tried, I ran back home. We used to live in the same house with my grandparents, and I tried, to do that. And then I remember how frustrated and how angry my uncles were. I have 6 uncles. We all come from like very large extended families in the Arab world, if you like, most of us do. And they were very frustrated and very angry, and they thought I was very rude that I actually attempted to do something painful, something disrespectful to my grandma, who is someone who's supposed to be very respected, someone who we should be taking care of her. And I think the cultural norms they just don't apply in the majority of what we learned. And it hit me very, very early on in OT school. I think that incidents happened between the second and the third year of a 4-year program. So like smack in the middle. And I was like, yeah, what I'm learning is just not applicable, and we have to think of ways to make it more logical if we want it to stick. So it hit me very, very early on that the independence goal that all our OT school is revolved around doesn't apply to my people. So that was, one of the things that I think highlighted how I chose to move forward with OT.
And this is like a fundamental difference between West-oriented OT practices and foundations and East, or other cultures. As you said, it's like independence in our culture is contextual. It depends on the family, the place, the culture, all that. So this is a fundamental difference. Thank you for highlighting that. Okay, so now we're switching gear to intersectionality, and where things get like in the mix. So can you tell us a little bit about how your how does the intersectionality of your Arab identity interacts with your OT identity? Is that a happy clash? Is that a harsh reality to, or like mix of identities to have? How does that feel for you?
I think when I was younger, the clash was definitely there. I was trying to like fit into a mold that wasn't perfect. It's like, you have I don't know, like the example that we always have, like we have like a peg that is like in a triangle form, and you're trying to fit it in a circle. This is exactly how I felt. Like, I've been fed like these information in school and ways of thinking, and then it just doesn't match the context, as you said, the life that we have, and it just wasn't applicable. And so I felt like there was a clash early on, and that was always it was always in my mind. I didn't feel comfortable. It's not also comfortable. It wasn't, I don't feel like I had the the proper understanding philosophically of even communicating what was going on in my head. Now it's very clear to me, like thinking back, I know exactly what was going on, but in that moment it didn't really make sense, and I felt it was just off. Like there was something that is just not appropriate, or it was just not working, and I'm trying to fit something in something else that is just not working together. So I felt that there was certainly a clash early on. But then as I grew up, and as my identity also, like don't forget, like when we're younger, when we're doing our undergrad, we're still forming our identities as adults. We still don't know who we are, like right. And we're still trying to experiment, like, am I this or am I that? Am I someone who's like flexible? Am I easygoing? Do I want to be harsh? Do I want to be like fun? Do I want to be strict? Do I like we don't know anything about it. So it's a blend of both. So it was both like the OT that didn't like 100% fit my style, but there was also like my identity that is still forming. So you have like these two areas that are still developing. So I think in parallel, as I grew up older and my experiences grew with OT and my identity started forming, I stood there, I think with time, more cohesion started to develop, and it was a lot easier for me now it's a lot clearer for me, and I anticipate that with time it's a lot more, it's a lot better, because and the other thing is I feel very strong that I can speak my truth. I don't fear, like because when I was younger, and especially when I immigrated to the UK and the US as parts of like my OT journey, I was always the minority, right? So no one in the room looks like me, no one in the room feels like me, no one in the room knows the experiences that I can bring in. So most of the time in the beginning I chose to stay quiet. I wouldn't speak up. I would just, it was like, yeah, this is how they want to do it. I'll just do it the way they want. And I don't want to be a troublemaker. I don't want to be that. But then with time and with with the courage and with the experiences that you go through, you'll be like, you know what? I'm just gonna say it. If they want to take it. They don't, but I just can't, يعني I don't know how to say it يعني ما بقدرش أضل أضحك على حالي. I know I'm speaking in Arabic بس إنه it's like I'm fooling myself. Yeah, and I don't want to be like a hypocrite where like I just keep shaking my head, because if you stay quiet, it's a sign that you're in agreement, and you don't want to be like that. And I think now I'm in a place where I've had my fair share of like experiences and things, and I feel like I can speak up and say when things don't fit, when things just don't sound right, and challenge the status quo, especially with like OT practice and how OT is delivered in the US. So and unfortunately, it's not, I don't know if unfortunately is the right transitional word, but it's hard work, and it's tiring, and it's you always have to just put yourself out there for people to see, and that's not the norm in the US. Here people they just want to do things, I don't want to say the easy way, but the usual way, because you just you have like volumes of work that needs to get done, and if you challenge that, like I've been called things like the troublemaker, the problem child, and especially in my role now, like I'm seen as the the person who's always coming up with these. They could be like new and innovative ideas, but they're definitely troublesome for a lot of people because they're not familiar with them. So
I agree. And you just talked to the lived experiences of all the minoritized groups and marginalized communities, and it is hard work, it is exhausting, and it takes a lot from you. It takes a lot of heart and mind and soul and courage to speak up, and being vulnerable, putting yourself out there and speaking up to your truth, and you may be against the current, is not easy. And that's why I was like, we're doing this, and that's why we are creating these spaces so we can speak to our reality, and the truthless told that what, these things don't make sense to everybody, and just because you're used to it doesn't mean this is how it should be done. People should just fit in the ways that OTs is delivered, OTs introduced, or even practiced. So I love that you're speaking up more, and we need all the OTs identifying as Arabs to take that space and have the guts to be vulnerable as well, because that's the only way forward.
Yep, absolutely.
So I appreciate you saying that.
Yeah.
Okay, so now we were digging a little bit deeper, and you touched on that. If you can tell us a little bit about the struggles of being an Arab specifically, and not just in general, but to you as a person. What are the struggles or the negative aspects of being an Arab OT in the United States?
Oh, that's a loaded question. I don't know how to even start to unpack it. I think one of the fundamental things that I experienced is the differences in just societal, upbringing. Here in the US, the majority goes with individualism. You want to move forward as an individual. You try to promote living by yourself, being by yourself, and being productive by yourself, hence where the independence comes as a long-term goal. As an Arab, and the way that I grew up was completely opposite to that, which is more, community-driven, more societal-based, more you get your strength from the group, and you're never by yourself. And I think this is one of the struggles that I personally have here, where everyone is trying to push the agenda of, we want to promote that you're living by yourself and you can do everything by yourself. And the strength comes from being by yourself, where, in my opinion, and especially with my work in community-based rehabilitation and in working with refugees, you never, ever get your power from inside. You get your power from being around the people who are with you. That's why, minoritized groups, especially in the US, some movements, for example, Black Lives Matter. And for example, I identify as a Palestinian, and, the struggle that Palestinians, go through, the collective experiences that people who have oppression is strength by itself that we should be building on. So when you say something like, I'm gonna, work on, my personal goals, it's never the person in the middle. All the OT frameworks, all the theories, they have the person in the center. I don't see that at all. It's the community in the center. I get my courage, I get my strength, I build on my strength from my community, and then I take it out to the individual, as opposed to the other way around that the OT, tells you in the US. So this, this is my fundamental, difference with the OT practice here in the United States. And when I start saying things like that, well, the community is not there. And it's like, well, you're part of the community. And it's like, no, you are the community. You're the society, you're the fundamental unit of the society and the community. It's not the other way around. Here, they think that we are the building block and we build on. I'm like, no, we are the community and inside is the individual, not the other way around. So it's the difference in how you perceive it.
Yeah.
And using, and especially with a lot of I'm an advocate. I'm sure many Arabs are too, and we all have things that we advocate for. And unless you think of communities and societies as a whole and bring them in as the core foundation of practice, we will never resolve any of the oppressions that are going on around us. So this is my fundamental.
Yeah, and I think that's very well said, Rawan. I think when I think of communities, I do see that beehive. It's the whole community that's supporting each other, and I agree with you. I think we have to, if you look at the AOTPF and all the frameworks and the models, we always value the individualistic view and independence of things, as if we live in cubicles or like in individual cells, and that is not the case. And I do agree with you. We need a massive movement to move or support community-oriented independence, community-oriented functioning, because not only to the Arab culture, but a lot of other cultures, they identify with community-oriented existence and being. Absolutely. And I don't see a lot of either education or research or practice done that way. So the road is very long for you and us in cultivating such mentality. So thank you again for highlighting that. Okay, so the next is our questions about allyship and accomplishship, and like how people who don't identify as Arabs, like how can they do to help with this? And again, allyship is allyship. Doesn't matter. It's an attitude. It's a mindset. It's a call to action. So can you share some of the examples that you think non-Arab OTs can do, whether it's activities or things or statements, that they can show their culture humility when interacting with OT identifying clients? How does culture humility look like for a non-Arab OT working with an Arab OT or like a client? Sorry.
Yeah, that's a great question. I prefer to think of, interactions between people without identifying like an Arab or like a Mexican or Asian or like, whatever like cultural group. Because as you said, cultural humility is a mindset. And I think the workplaces and lots of like education places now, they, I'm going to be very frank, like the institute that I work in now, they just went like a 2-year review of our syllabi and our curriculum to check if we are, well, equipped with JEDI, like, justice, equity, diversity, and inclusion.
Yeah.
And what it turns out that I had to look at the majority of what my peers did, and I'm just going to be very blunt. And what they did is basically they ensured that they included like a case study of someone who identifies as Black, or someone who identifies as a Syrian refugee, or someone who whatever, or they added an article to, about like Vietnamese Americans, or they added something like, they're just like these add-ons on like, and this is what basically happens with a lot of organizations now, which is their introduction of something we called cultural competency, where you basically introduce like a set of, information about a certain like culture. So for example, one of the things that, not one of the things, many of the books that have, that an OT, like Willard and Spackman and Pedret, like all these, books that are the texts, the classical textbooks in OT, they say things like, you should be aware not to touch like a female if you're a male, not to like introduce someone who's like older than you by greeting them out of respect, like these things that tell you like how you should assume interactions with people. And in my mind, I think this is so much more harmful than not even including them. Because what happens is when you introduce things like this, you're kind of solidifying the stereotypes that you should, enforce.
Yeah.
I'm a Muslim. I shake hands with men, and I don't want to stop doing that anytime soon, for example. Not that I am saying that this is the right thing or the wrong thing, but when you add it in like a training piece or in like a course, people assume that this is how everyone wants to be treated from this, group. So this is what cultural competency is, where it's like you're assuming that, oh, I learned a little bit about this culture, so I'm going to treat everyone the same from that culture. And I think it's exactly what you said. We should go into this with like cultural humility, where I go in with my interactions. Like I went into this phone call with just, this intention that I want to learn about you. I want to learn about how you want to do things. And we're going to come in the middle between what I know and what you know, so we can make the world a little bit better or problem solve, together.
Yeah.
So this is, in my mind, what cultural humility is. It's basically being open to being a lifelong learner and wanting to be. So allyship doesn't come with this like, oh, I learned everything about Muslims. I learned everything about Arabs, because there's no one in the world who knows everything about, every group. You're just, tricking yourself, and you're believing nonsense if you want to go down that route. But it's basically the mindset that a true ally is basically someone who goes into the interaction saying, these are the experiences that I know. I'm here to assist you with this. If you want assistance in this, let's work together to basically come from A to B. So if you're like a client who has a problem, let me share your problem with me, and I'm here do you want me to be a problem solver? Do you want me to be someone who helps you? Do you want me to be someone who gives you recommendations? What kind of help do you want from me? And that all is always like dependent also, because, even problem solving might not necessarily be the thing that people, want. So you have to make sure that you're asking, the questions that are appropriate, and that you're just there in basically going into, it's just like, relationships, like, you come in from one side and then you have the other person coming in from the other side, and you want to meet in the middle. And it always happens when you have good intentions coming into the conversation. And this is, I think, what allyship is all about.
I think these are very wise words, and I think they're, students can relate to educators, researchers, practitioners, and I do agree. It's coming in open ears, ready to listen, and with no judgment, with no judgments about things. So thank you so much for that advice. I could talk with you for hours. You know that. I enjoy your company personally. Rawan is a very dear friend of mine. But I want to end with a question. If you can debunk one myth about Arabs in general, what would that be?
We are not intimidating. We're not scary. I get that in my course evaluations all the time as a woman who wears a hijab. They think that I am unapproachable and I'm scary, and that I'm there to like destroy everything. I don't want to use the word that starts with the letter B, but that's what people think. And we're a lot more friendly than people think we are. And we're excellent cooks. So try to get to know us or you'll miss out.
Exactly. Oh my God. I tried your cooking. And
I tried yours as well. So
she's not good. She's not kidding. So thank you so much, Rawan, for this. And I'm sure we'll have you again to talk about specific things and specific areas. I really appreciate your time. Thank you so much.
Thank you.
Post this on the group, and hopefully if anyone has any question, we'll reach out to you directly.
Absolutely. Yeah.
Thank you
again.
again.
Thank you, Dr. Jazan. Thanks.
Bye-bye.